Hi everybody. I have been really thinking a lot how to help you all understand this information a little bit better. And I know it's very difficult. This is your first class. Many of you may not be familiar with online education. And sometimes people feel, well, I feel as though I'm teaching myself the class. Well, in many ways you are. You don't have the advantage of going to a classroom and listening to a lecture. That's one of the things that I didn't like the most about online classes is that lack of interaction. You know, when you go and you sit and you listen to a lecture, you take notes, and you can pretty much figure out by the notes that you're taking what that material is going to be over. And you don't have that benefit when you're taking online courses. So, and also if you have a burning question, you can ask your professor face to face and she can write it out on the board and do it over and over until you understand. And also you have the interaction with your peers that you have in the classroom. So I understand the difficulties with adapting to online education, plus coupled with the difficulties that occurred related to examiny, caused some stress. But moving forward, I elected to try, and since this is your first class, I elected to try something a little different. Now the PowerPoint presentation you're watching today is a PowerPoint presentation that I developed for another pathophysiology class that I taught for a different university. But I think that you may find it helpful. The whole thing is, I know you're very focused on passing tests and writing papers, but the bottom line is you have to understand the concepts. You just can't study 50 topics for a 50 question test. You need to understand the whole concept because you are all going to become nurse practitioners. Nurse practitioners provide complete care for patients. We don't, and now in the state of Illinois, we no longer need a collaborating physician. So it's you, and you're the one that is going to be making the decisions for these patients that you're taking care of. It's you that are going to be writing the orders and prescribing the medication and ordering the tests and counseling patients. So you really need to know what the concepts are. So I thought we would go over this and you let me know if you find it helpful. This is a 3-lecture series on the cardiovascular system and the lymphatic system. All right, so the circulatory system, it encompasses the heart, and you have your right heart, pulmonary circulation, it pumps through the lungs, and then you've got the left heart, systemic circulation pumps through the body. So right heart, left heart. Now this first presentation goes more into the anatomical side of the circulatory system. So I might go through it rather quickly because you should have a good understanding of this. This diagram just signifies the way that the circulatory system works. Now, and the components of the heart, the mediastinum, the heart wall is comprised of 3 different layers. And then you have the pericardium, which is 3 areas also, the sac, the cavity, and the fluid. This picture illustrates the heart wall and what it looks like. And then we have the chambers of the heart. There are 4 chambers of the heart, right, left atrium, and right, left ventricle. I always used to remember right to the lungs. So I would know that if I needed oxygen, blood was going right to the lungs from the right side of the heart. So here are the different chambers of the heart. You can see up at the top here, we have the atrium, both atria. I'm trying to get my little pen to work here. It doesn't want to work. So we've got the atria, and then we have the aorta, pulmonary trunk, all of the anatomy of the heart. But as I said before, you should have a rather good understanding of those concepts. There we go. Okay, next slide. We've got the atrioventricular valves, tricuspid and mitral, and the semilunar valves, pulmonic and aortic. And that's what the valves look like. They're little, gosh, what am I trying to say? These little, I don't want to call them wings, but they're these little areas that prevent blood from backflowing. So it's very similar to the little valves that you have in veins to prevent blood from backflowing, but these are in the heart. Then you have the great vessels, and these are really large. The superior and inferior vena cava, the pulmonary artery, right and left pulmonary arteries, and pulmonary veins, and then the aorta. The aorta is like a garden hose, and in the older population, we get concerned about conditions like aortic dissection. And always consider someone, an older person that comes in with crushing pain in the abdomen. That's the first thing that I'm going to think of. Blood flow in the cardiac cycle. We've got the cardiac cycle, which consists of diastole, asystole, and the phases of the cardiac cycle. And this is what it looks like with an atrial contraction and a ventricular contraction. Blood flow in the cardiac cycle continued, and you can follow this to see where the heart sound goes, and this is the old lub-dub, so you should understand those sorts of things. This shows normal intracardiac pressures that you'll see, and anybody who's in ICU, I'm sure, has a very close relationship with these numbers. And then we have the coronary vessels, the right coronary artery, the conus, right marginal branch, posterior descending branch, the left coronary artery, the left anterior descending artery, and the circumflex artery. Those are the arteries that feed oxygen to the heart itself. So these are the things that get occluded when someone has an MI. You have the collateral arteries, coronary capillaries, and veins, and so forth. And then you've got the lymphatic vessels. And this is what the vessels look like. Anytime you see a graph, blue indicates venous circulation or unoxygenated blood, and then red represents oxygenated or arterial. So you don't need to answer that question. I'm not altering these PowerPoint presentations. So the structures of the heart that control heart action: cardiac action potentials, the conduction system, which consists of the SA node, AV node, the bundle of His, right and left bundle branches, and the Purkinje fibers. And this is what it looks like and where everything is. You know, someone who's got a irregular heart rate, perhaps their SA node is not triggering there. It could be triggering at different areas. So all sorts of things for our cardiac people out there. The propagation of the cardiac action potentials. You have the resting membrane potential, depolarization, repolarization, hyperpolarization, the refractory period. And so this you can see on an electrocardiogram. So our cardiac nurses out there, I'm sure that you'll be able to recognize some of these rhythms immediately and what they mean. So this is your typical electrocardiogram, and you should know this from back in nursing school: the P wave, the QRS, and the T. Structures that control the heart action. You have cardiac innervation by sympathetic and parasympathetic nerves. You've got adrenergic receptor function, which is beta, adrenergic receptors, and norepinephrine or epinephrine. And those things are related to the fight or flight. So what happens when you have your sympathetic nervous system kick in? Your heart starts to beat faster because it's pumping oxygen, because it's saying, okay, something's going on here. I need to provide the body more oxygen so that it can do what it needs to do to get out of the situation. Okay. Myocardial cells are very close to skeletal muscle cells. But there are some differences. Sarcomeres are in myocardial cells, and they are intercalcated discs. We have actin, myosin, and the troponin, tropomyosin complex. Now that's what you're looking for if you're worried about someone having an MI. You're going to draw troponin levels on them. And then you have a myocardial metabolism. Myocardial contraction and relaxation is a cross-bridge theory of muscle contraction. So excitation, contraction, coupling. Also, calcium channels are involved in the heart contracting and relaxing also. That's one of the reasons we give calcium channel blockers. And this is an illustration of contraction and relaxation and how those fibers of the heart actually intertwine with each other so that the heart will relax or contract. This is a closer picture of how these things work. And you see this troponin here on this muscle cell here. So when someone has an acute MI, that troponin is released and goes into the circulatory system. And that's why we look for elevated troponin levels in our patients with acute MI. Some more pictures of contraction and relaxation. We're going to skip that one. Cardiac performance. We have cardiac output. The preload, volume pressure inside the ventricle at the end of diastole, left ventricular end diastolic volume, Lepan's law, and the Frank-Starling law of the heart. The afterload is related to resistance to ejection of blood from the left ventricle, and load muscle must move after it starts to contract. And this is determined by the system vascular resistance in the aorta. Myocardial contractility is dependent on stroke volume and preload, inotropic agents, oxygen and carbon dioxide levels. The cardiac output is the volume of blood flowing through either the systemic or pulmonary circuit in liters per minute. And also the ejection fraction is considered in cardiac performance as well. And this little graph here explains cardiac output. This is like a algorithm that I developed. I'm a visual learner, so I like algorithms. Cardiac performance, the heart rate, cardiovascular vasomotor control center. We have the cardio-excitatory and cardio-inhibitory centers, neural reflexes, vein bridge and baroreflexes, atrial receptors, hormones, and biochemicals. Those are all things that influence the heart rate. The systemic circulation is performed by the arteries, arterioles, capillaries, venules, and veins. The structure of those blood vessels, each blood vessel has a lumen, the tunica intima, the tunica media, and the tunica externa. This is the endothelium, and you can see what each one of these blood vessels looks like and the different layers that are associated with them. The outside of this vessel is connective tissue. So that connective tissue is on the firm side. Structure of blood vessels, you can see the artery is, the wall is much thicker, and that being, of course, because the blood flowing through arteries is flowing at a much higher pressure than in veins. The structure of the vein, you can see, is not quite as thick as this. It's much thinner because it doesn't need, it's passive. Veins are passive. There's low pressure. The structure of blood vessels, and you can see when the muscle is relaxed, low pressure on the inside. When the muscle is contracted, we have high pressure here, and the valve closes. See how the valve is directly related to the difference in pressure gradient in the vessels. Factors affecting blood flow is pressure, of course, force exerted on a liquid per unit area, resistance, and a Poiseuille law. And I wouldn't worry about looking up these things. I just am trying to give you a good overview of the cardiac lymphatic system. And this is a lot of anatomy that you are familiar with already. Factors affecting the blood flow, the neural control of total peripheral resistance. So change in the diameter of vessels. One of the problems with high blood pressure is a narrowing of the arteries, which causes the heart to pump harder to get the blood through the systemic circulation, and that results in high blood pressure. Baroreceptors influence blood flow, and so do arterial chemoreceptors, all those things. You know, all those chemical mediators that are released, chemoreceptors being one of them, and chemoreceptors are directly related to the stress response, cause your heart to beat faster. So all of those things, and baroreceptors in the brainstem that are, well, it connects the brainstem to the heart, cause issues with heart beating faster or slower. And here is a picture of the baroreceptor and chemoreceptor, and you can see here in the brainstem here, the nerves attached, the sympathetic chain, how it's so interesting when you see this, how these nerves go through the spinal column and then come out in different areas to touch different areas. And the heart is so incredibly important. Factors affecting blood flow is the velocity, laminar versus turbulent flow, and the vascular compliance. So how thick is the blood? How narrow is the diameter of the vessel? The vascular compliance, is it too rigid, like in arterial sclerosis? And this is a picture illustrating it. We're not going to look at that one. Regulation of blood pressure. We have arterial pressure and the mean arterial pressure, effects of cardiac output, effects of total peripheral resistance, effects of hyperemia, effects of hormones. So we've got epinephrine, norepinephrine, antidiuretic hormone, renin-angiotensin, aldosterone system, and natriuretic peptides. Now all of those things influence arterial pressure. It can make it go up, it can make it go down. So if your antidiuretic ADH is too high, what's going to happen to your blood pressure? It's going to go up. And here's another little algorithm. You may not find this helpful, but like I said, I'm a visual learner, so I try to incorporate as many different methods of learning in my teaching as I can. Some other mediators, nitric oxide, adrenomedulin, and venous pressure also are related to that. Regulation of coronary circulation, coronary perfusion pressure, autoregulation, autonomic regulation. All of those things are involved in that. Now let's talk a little bit about the lymphatic system. It's a special vascular system, and what it is the lymphatic system is the filtering system of the body. It picks up excess fluid and returns it to the bloodstream. So all that excess fluid gets picked up, goes into the bloodstream, stream, is then filtered through the kidneys, and then we urinate the excess out. We have lymphatic fluid in the lymph, lymphatic veins and venules. We've got the right lymphatic duct, the thoracic duct, lymph nodes, afferent and efferent lymphatic vessels. Now, with the lymph system, if anything blocks that lymphatic system off, and this was one of the test questions we had, it's going to cause edema because it's not allowing that excess fluid to filter back into the lymphatic system where it's discarded by the body. So it builds up. That's one of the reasons that people have lymphedema. I had a patient that had a melanoma surgery, and the melanoma surgery was on her leg, but the surgery was so extensive and interrupted the flow of the lymphatic system that now she suffers from chronic lymphedema in her right leg. And that's so unfortunate. Of course, I'm the, I'm the Monday morning critic or whatever you call that, but quarterback, the Monday morning quarterback, that I think to myself, my gosh, did she have a really well-skilled surgeon that he caused so much lymphatic damage? Because the area of the incision was probably about, I want to say, 4 inches long. It was approximated well. I don't know, left a lot for me to think about. And this shows where the lymphatic system is. You can see you have these chains that go all throughout the body. And when you're examining the patient, especially for a sick visit, you're going to definitely examine these cervical lymph nodes. When you're checking these, they may be swollen. Anytime a lymph node is swollen and it's hurts and it's mobile, 90% of the time it's infection or virus. When you worry is when it's firm and fixed and doesn't hurt. Those are the 3 things you really worry about in the lymphatic system to rule out any type of malignancy.